My name is Lawrence Lustig. I am a professor and chair of the Department of Otolaryngology, Head and Neck Surgery at Columbia University Medical Center and New York Presbyterian Hospital. I am a otologist, neurotologist, and skull-based surgeon, and I have been involved in the Otoferlin project on many levels. In my lab many years ago, we worked on an animal model of Otoferlin-related deafness and able to show that the feasibility of this was possible. And then more recently, I have been the site-specific principal investigator for the otoferlin gene therapy trial, the CHORD study group through Regeneron. Otoferlin is the cause of an ultra-rare genetic disorder that leads to deafness at birth in most cases. The otoferlin gene codes for a protein that allows the hair cell of the cochlea. These are the critical cells that convert sound waves into electricity that the brain can understand. When you lose otoferlin function, the hair cell can no longer communicate with the nerve going to the brain. So it's like shutting off hearing. So what the otoferlin gene therapy does is it restores normal otoferlin function and allows the hair cells to start talking to the nerve again and essentially restoring natural sound hearing to an otherwise deaf ear. Right now, you've got a couple of options. One option is to do nothing and track them into the deaf community, which is certainly an option for anybody with severe to profound sentinel hearing loss. The other option, if you want your child to hear, is cochlear implantation. And the treatment, the standard at this point is cochlear implants for these children. The DB-OTO is it's a virally mediated gene therapy. The gene itself, the full-length gene, is too big to be able to be packaged in a single virus. And so the trick that had to be done to allow this to work is to cut the gene in half, if you will, and then put sticky ends on either half. And then each of these halves go into a separate virus. And when these two viruses each transfect a cell, each half comes together and recombines to the full-length DNA and allows the normal protein to be produced into the gene, and thereby allowing normal natural function of the hair cell to continue. So the CHORD trial, it's an investigational study that we've got initially coded for 30 patients to be enrolled. The study that we just recently published on has 9 patients who were dosed in one ear and 3 patients that were dosed in both ear. The technique that we use to get the drug into the inner ear is a very standard procedure that we use for cochlear implantation. It's an incision behind the ear. We then drill through the mastoid bone to get to the middle ear, and using a very small catheter, we very slowly infuse the medication through the inner ear. We make an accessory opening somewhere else in the inner ear to allow us to flush the fluids out completely and get really complete drug delivery throughout the entire inner ear. So we had some specific endpoints we wanted to achieve. So for example, any improvement of the ABR over baseline greater than 10 decibels, and 92% of the patients achieved this key primary endpoint. Another endpoint was to try to get hearing better than 70 decibels. And 75% of patients achieved that endpoint as well. We had 3 patients who had hearing essentially in the normal hearing range. And we had another 6 patients that hearing greater than better than 45 decibels, which would be the equivalent of a kind of a mild hearing loss in human terms. This is our first publication on this really early hearing result. These are results out 24 weeks in all of the patients, 72 weeks out in the longest of the followed patients. So the next step, number 1, is to try this in a larger set of patients, and that's ongoing. We've got clinical trial sites around the world, the United States, the UK, Spain, in Germany, and really to follow these patients over time to see what happens. We, at least in the patients that we followed up to 72 weeks, the treatment appears that it's either stable or continues to improve in some cases. Interestingly, one of the patients who didn't achieve our initial primary endpoint ended up having almost normal hearing after 72 weeks. So there does appear to be a delayed response in some patients, but no patients lost hearing after gaining hearing back, at least over the time course that we studied them. This is a huge team effort, by the Regeneron team and all of the different sites around the world. We are all really excited about the results of this study. not only for the kids that are now able to hear that would otherwise have required a cochlear implant, but also because it demonstrates the feasibility of cochlear gene therapy for genetic deafness. And I think this is going to spark a number of other studies for other types of genetic deafness. This is a relatively rare form of deafness, and our hope is that these types of studies can now be applied to patients with more common types of genetic deafness.